Okay, so as I said, this is the last in the series of Medicare changes for 2022. So before we go ahead and start, if I could get, well, I don't know why this is giving me such trouble here today. Okay, so we have a short poll, and if people could take a few minutes and fill out the poll, that would be helpful. It just gives me an idea of who is joining us today. So there are just a couple of 3 or 4 questions. If you could go ahead and start filling those out, I would greatly appreciate it. Okay, so it looks like about half of you were able to complete the poll. And we have the majority of people coming or between the ages of 65 and 79, which is pretty normal for this type of a presentation. People from pretty much kind of around the state, which is great. And the majority of individuals who completed the poll report as white. So with that, we'll go ahead and launch into the presentation. So the cost of living adjustment this year for Social Security, as some of you may have heard, is going to be 5.9% in 2022. So if you are getting $1,000 a month in Social Security starting January 1, you will get approximately $500 or $59 more. That is a very significant increase in Social Security. The reason that we pay attention to the Social Security cost of living increase is that that also helps to drive the amount of increase that we will see in the Medicare Part B premium, which, as we will see in a little bit, is pretty substantive. So the most important thing that I want you to remember in terms of Medicare is that Medicare has parts, and there are 4 parts: A, B, C, and D. In addition to that, what Medicare does not cover, we supplement with what we call plans. So there are Medicare Advantage plans, which is the same as Medicare Part C. There are prescription drug plans, which is Part D. And then if you choose not to have a Medicare Advantage plan, but you want to supplement Parts A and B, you will have a Medicare supplement. Now, what sometimes gets confusing on the Medicare supplements is that they also have plan A, B, some people still have C, D, some people still have F, G, and K, L, M, N. So Medicare supplements have plans with the same identifying alphabet soup as parts in Medicare Part A. So it's important, or in Medicare, so it's important to try to keep those separate. So let's start out with Medicare Part A, which is inpatient care for hospitals and rehab centers. Some of you may know this as skilled rehab following a hospital stay, some home care, and hospice. So 2022 Oh my. I'm sorry, you guys, I pulled up the incorrect Medicare, or the incorrect PowerPoint. So we just got new figures on Friday for some of these costs for Medicare. So Part A is free for most individuals if you have either paid yourself into 40 quarters of Social Security, or if you are married to someone who has paid into 40 quarters of Social Security. For those people who have not paid into Social Security, but they have paid at least 30 quarters, 30 to 39, their monthly premium is going to be $274. And for people who have paid in less than 30 quarters, their Part A premium is $499 in 2022. What we know is that the majority of people at this point in time who have not paid into Social Security primarily tend to be federal government employees who, until somewhat recently, were mandated to start paying into Social Security. So that's the group of folks that we most frequently see who do not have enough quarters paid into Social Security, but have to pay that out of pocket. There are others, but they are less frequent. So in Medicare Part A, the deductible happens basically in what we call a benefit period. A benefit period is every 60 days. So if you go in the hospital today, which is November 15th, and you were to go back in the hospital again by January the 15th, if this was in the same calendar year, you would have to pay a new deductible. If you went in the hospital on January the 14th, if this was the same calendar year, you would not have to pay a new deductible. If you go in 60 days or more, you get into a new benefit period. Each benefit period then carries a deductible of $1,556. This benefit period not only includes your inpatient days in the hospital, but it also includes your skilled nursing facility days. So if you are in the hospital, say for 5 days as an inpatient, and then you went to skilled rehab for 60 days, basically you would have 65 days in that benefit period. And 5 of those days would be outside of this deductible period. It ends basically when you have been in the hospital or in the skilled rehab 60 days in a row. If you are unfortunate enough to be in the hospital more than 60 days, and you are in between 61 and 90, your copay is $389 a day. If you are in the hospital 91 days or more, it's $778 per day. Now, one of the things is that you also have lifetime reserve days, and these lifetime reserve days can be used if you want, but once you use them, they do not, you don't get them back again. So people are usually very, very careful about whether or not they use them if they have to be in the hospital for longer periods of time. The benefits for Medicare Part A is hospital inpatient coverage, whether it's for physical or mental health purposes, skilled inpatient rehab, skilled home health, and hospice care. So to take advantage of the inpatient hospital care, you have to be admitted as an inpatient. You have to spend 3 midnights as an inpatient. So if you go to the hospital through the emergency room, and in the emergency room, you are basically considered an outpatient. So until they give you a notice called a Medicare Outpatient Observation Notice, you are considered an outpatient rather than an inpatient. The hospital has to basically give you a notice at 23 hours and 59 minutes as to whether or not you are going to continue as an outpatient in the emergency room or whether they are going to move you to an inpatient. Once you have been moved to an inpatient, for you to qualify for rehab benefits, you must spend 3 midnights in the inpatient part of the hospital. You can also be an outpatient in ER. You can be an inpatient for 2 days, and then you could be an outpatient again for the last day that you are in the hospital. So it's really important to know exactly what your status is when you are in the hospital, because this will affect your eligibility for both Part A home care as well as skilled rehab services. When the hospital gets ready to discharge you, and oftentimes they will start this process almost immediately when you are admitted as an inpatient, they have to give you something called an important notice from Medicare. This is a document that tells you when their planned discharge time and date is. If you come close to feeling like the discharge date is pending and you do not feel safe going home or being discharged, you can ask for an expedited appeal. And with that appeal, then the hospital is required to go to a third-party vendor, have your case reviewed, and if the third-party vendor comes back and indicates that your skilled rehab or that your hospital stay should be extended, usually we find that that's a benefit to you, even if it takes a day or so for that extended expedited appeal to be approved. Oftentimes we find that people get stronger and are safer to be discharged from the hospital. However, if you get this important notice from Medicare and you sign it, then you give up your opportunity for this expedited appeal. So make absolutely sure that when you get this notice, that you really do in fact feel safe and that you'll be able to manage if you go back to your home, or if the skilled rehab facility is in fact able to provide services for you. The second benefit is the skilled rehab facility stay. As I said a moment ago, you must meet 2 conditions. One is that you must have met the 3-day hospital inpatient stay. And the second criteria is that you must need skilled services. These skilled services can include things like therapy, wound care, skilled nursing, patient teaching, help with catheter care, learning how to manage those kinds of services that or benefits that you may need as a result of some previous health condition change. When you go to the skilled rehab facility, days 1 through 20 are cost zero. That is part of your Medicare benefit. This is true if you are in either a Medicare Advantage plan or in original Medicare with a Medicare supplement. If you go into the skilled rehab and it takes more than 20 days and you are there between 21 and 100 days, your co-insurance will be approximately $195 per day per benefit. If you have a Medicare Advantage plan or a Part C, you will have to pay that $194.50 yourself. If you have a Medicare supplement or you are on Medicaid, they will pay that $194.50. After day 101 in a skilled rehab facility, you are responsible for 100% of the costs. Usually what happens if you transition from a Medicare bed to a long-term care bed is that then your rate that you are charged basically is the daily rate that the nursing home charges. You become a long-term care patient and either you pay that privately or the nursing, or you are eligible for Medicaid. The home health benefit, there is a benefit for home health under Medicare Part A, and there is a home health benefit under Part B. Under Part A, you again have to have the 3-day hospital stay. You must need certain types of skilled services, again, very similar to the nursing home skilled services with nursing and or therapy support. And the criteria here is that you must be homebound. So in order for home health to be paid for under Medicare Part A, you have to be basically, it takes an inordinate amount of energy and it has to be basically medically necessary for you to stay in your own home. The only two exceptions for not meeting the homebound criteria are you can go to an adult day program or you can go to religious services. The cost for Medicare Part B or Part A home health care is zero to you. Under hospice care, this one works a little bit differently, has nothing to do with a hospital stay at all. You do have to have a terminal diagnosis of 6 months or less. You basically have to decide that at this point in time, you are going to terminate all care, specifically around any type of either maintenance care or treatment for acute or chronic conditions. And that basically you are going to choose that you want to be kept comfortable, that you want to do pain management, and that you basically expect that this terminal diagnosis that you have, that you will pass away in 6 months or less. The way that this works is that it can be authorized for 60 days, and then you get a second authorization for another 60 days, and then you can get a third authorization for 90 days. After that 210 days, if in fact you need additional time and your condition continues to deteriorate, your hospice stay can be approved for more than that. There are some people who are discharged from hospice. They their condition basically does not deteriorate, doesn't necessarily improve, but it does not deteriorate. And so they then unfortunately have to be discharged from hospice. Oftentimes, this is a very difficult decision because there have been a lot of services provided by the hospice organization, and the family has to figure out new care arrangements. The cost for the actual hospice services, which includes nursing, social work, chaplain services, physician services, any hospitalizations associated with the hospice condition, anything associated with hospice basically is billed to hospice, and there's no charge to you. There is a $5 charge for prescriptions as a copay. And if for some reason you take advantage of a respite service, either having someone come into your home while your caregivers leave for a few days of respite and basically being recharged, or if you go to a long-term care facility, a skilled rehab facility for 5 days, that's usually the maximum, then you would have to pay 5% of that cost. If you are on hospice and you are either in an assisted living or you are in a nursing home, you would have to pay 100% of the charges for room and board. The next thing we want to talk about briefly is Medicare Part B. This is outpatient services. Just announced on Friday is the new Medicare Part B premium. This is a very significant increase. This went from $148.50 per month to $170.10. So this is an extremely significant increase in your Medicare Part B premium. Individuals who have less than $91,000 adjusted gross income or $182,000 or less adjusted gross income will only pay the $170.10 Medicare Part B premium. If your income is greater than that amount, you will have to, on the Medicare Part B premium side, pay an additional charge for your Part B. Similarly, if your income is less than 91,000 as a single person, 182,000 as a couple, your Part D premium you would pay to the prescription drug company of your choice, and then you would be charged an additional surcharge. Those surcharges did not go up more than sometimes between 50 cents and $1 per month on the prescription drug side. On the Part B premium side, those increases were pretty significant. The Medicare Part B deductible for 2022 is going to be $233. That is up from $203. So again, it was a pretty significant increase. The Medicare Part B premium or deductible has to be paid by you before any other charges can be paid by Medicare. This deductible can be paid in several different ways. So individuals who have a Medicare supplement, plan A, B, C, D, no, A, B, C, or F, the $233, no, wait a minute. If you have a C or an F, the $233 will be paid as a Medicare supplement. If you have a D or a G or an A or a B or a KLMN, you will have to pay the $233. It's only paid once, and usually people pay it the first time that they are seen in an outpatient setting, the first of the year. Medicare then, after you have met this deductible, Medicare will pay 80% of what's called the approved charge. So just because your doctor bills $200, Medicare may only approve $50, and then they would pay 80% of the $50 or $40. You would pay 20% of the $50 or $10. If your doctor accepts that approved charge by Medicare as payment in full, that is considered accepting assignment. If your doctor does not accept assignment and wishes to bill additional or over and above the Medicare billed charge, there is a limit of 15% that they can charge in what's called excess charges. So in the example where we had the $200 bill charge, the $50 approved charge, an extra 15% would be $7.50. And either you would have to pay that excess charge, or if you have a Medicare supplement, that would pay the excess charge, or Medicaid may pay the excess charge as well. The excess charge and the 20% copays do not technically apply if you have a Medicare Advantage or a Part C. There is no annual limit on the out-of-pocket expenses for Medicare Part B. So if you charged up $50,000 and if those were $50,000 of approved charges at 80% and they were all approved, then basically your out-of-pocket would be $10,000. Now, again, that could be paid by your insurance, depending on the type of insurance that you have. The other thing in terms of Medicare Part B is that oftentimes when you go to the doctor, they are now asking you to sign something called an advance beneficiary notice of non-coverage. The reason they are asking you to sign that is because if for some reason or other Medicare does not pay the bill or approve the charge, then by signing this form, you agree that you will pay for the cost of that procedure. Sometimes you may want to consider that if it's a very expensive procedure and they're not sure if Medicare is going to pay, you may want to evaluate whether or not you need that particular procedure, or if there is an alternative procedure that could be done that would give them similar information. The original Medicare Part B benefits, this is a very busy slide, but what I wanted to do was give you an idea of the wide range of Part B benefits that Medicare does pay. So in addition to paying for your doctor, they also will pay for a large number of other things, such as preventive services, immunizations, advanced care planning, chemotherapy in the outpatient setting, telehealth. They'll now pay for that since the pandemic. They pay for outpatient physical, speech, and occupational therapy. They pay for some home care. So they pay for a wide variety of benefits. The other thing is that they also pay for durable medical equipment and diabetic supplies. In terms of Medicare and COVID-19, Medicare will pay for monoclonal antibody treatments. They will continue to pay for COVID-19 testing, even if you had all three vaccines or two vaccines. If you had the Johnson & Johnson and you've been exposed to COVID-19 and you go in for testing, they will continue to pay for the testing. They will pay for both the rapid tests as well as the antibody tests. They are still paying for the vaccine as well. So basically your Medicare is always going to cover any type of COVID-19 procedures, either at the testing or vaccine level, as well as if you should get COVID-19 and you have to seek medical care, Medicare will pay for that. Always make sure that you bring your Medicare card to any type of COVID-19, either testing, treatment, or vaccines. Medicare is usually one of these very confusing kinds of situations. So immunizations, some of them are paid for under your Medicare Part B benefit, which we just talked about, and some of them are paid under your Medicare Part D benefit, or your prescription drug benefit. So the general rule of thumb is that if you get the immunization at your doctor's office, a community clinic, or even possibly at the pharmacy, it could be a Part B benefit, or is usually a Part B benefit. If you get the immunization at the pharmacy, it is probably a Part D benefit. This excludes your COVID-19 vaccines. So the two Part B or D benefits that are most frequently sought at the pharmacy are shingles and Tdap, because your pharmacy is a participating provider in your prescription drug plan. The reason you do not want to get those two vaccines at your doctor's office or a community clinic is because most of the time they are not certified or approved to bill for Part D benefits through Medicare. They can only bill for Part B benefits. And the three primary vaccines that we use as older adults that are Part B vaccines are flu, pneumonia, and hepatitis B. So Medicare Part C, this is also sometimes called Medicare Advantage. Medicare Part C is basically subject to open enrollment. That is the season that we are currently in right now, from October 15th to December 7th. So you can make any changes that you want to your Medicare Advantage plan or to your Medicare Part D prescription drug plan. Your Medicare Part D is often an embedded benefit or part of your Medicare Part C Medicare Advantage. And if so, that is called an MAPD, a Medicare Advantage plan with prescription drug coverage. Coverage, if you sign up now, begins January 1 of 2022. Another thing to know real quick is the Part D Senior Savings Insulin Model. This is a Part D benefit, as well as some of the Part C or Medicare Advantage plans offer this and some do not. So one of the things that Medicare did a couple of years ago is that they added this benefit called the Senior Savings Insulin Model. What this means is that the very first vial of insulin that you need per month is covered by, or costs you $35 out of pocket. If you need a second vial of that same type of insulin, you will pay the full copayment. If you need a second type of insulin, you have two different types, and you only fill each one once a month, then you would just pay the $35 copay for each of the two different types of insulin. Within the Medicare Advantage plans, as well as the Part D plans, if you sign up for a plan that has basic coverage, it is not going to offer the senior savings model. So if you are looking to sign up and either keep the current Medicare Advantage plan you have, or change, or if you are looking for the same with a Part D plan, you will want to get the enhanced coverage, which basically gives you the benefit. Now, some of you are going to say to me, but Colorado has a law that says that I should not have to pay more than $100 per month for insulin. That is absolutely correct, but it only applies to people who are either on Medicaid only or who are in Connect for Health, which is the Obamacare plan. Medicare beneficiaries have to follow Medicare rules, and the state is not allowed to overrule them. There are 5 types of Medicare Advantage plans sold in Colorado. There are the HMOs, which is the plan that we are most familiar with. This is the one where they do a lot of care coordination. They usually make you choose a primary care physician. You stay within the network to provide to get your services unless it's an emergency. And they often have add-on benefits such as maybe some amount of vision, hearing, and dental, or some transportation or other kinds of services. In the Colorado marketplace, not all of these HMOs are offered in every zip code. They have to contract every year with Medicare for the zip codes that they wish to offer these products in. They can offer it this year in your zip code and decide next year not to offer it in your zip code, or vice versa. They can not offer it this year, but do an expansion and offer it next year. The second type of Medicare Advantage plan is what's called a preferred provider organization, or a PPO. The advantage of a PPO is that it has all the benefits pretty much of an HMO, but if you decide that you want to go outside of the network for care, you pay the 20% copay that we've talked about previously out of pocket, or you would pay under Medicare Part A, you would pay the full hospitalization out of your pocket. The private fee-for-service plans, which are my least favorite, they do require that the company have a network. They do suggest that you have a primary care physician. They don't do a lot in the areas of care coordination. They also don't usually offer as rich a benefit for like their vision, hearing, and dental services. But what always bothers me a lot about the private fee-for-service plans is that the provider can agree to accept your insurance this month, your Medicare and your Medicare Advantage plan. And next month, he can opt out and say, I'm not going to accept that. And then basically, if he does that, you are stuck with the full bill. So it's my least favorite because we can't really predict what kinds of insurance coverage we have. There are 2 additional plans called a SNP, a special needs plan, or a DSNP, which is a dual special needs plan. The special needs plans are offered basically for a certain group of people. They usually have all of the benefits of the HMO, but they often have a lot of additional benefits that whose purpose is to really care for either that specific chronic disease or series of chronic diseases, or that very low-income population. Most of them are offered, again, only in the Front Range, not a lot available outside of Metro Denver. The D-SNPs, or the dual special needs, these are specifically targeted to individuals who are on Medicare and on Medicaid. This year, they are offering some fairly rich benefits in this D-SNP program for that Medicaid population. They're offering, some of them are available with 0 premiums. They're also offering like additional vision, hearing, and dental services. They often are offering some transportation. They may have some meal programs that they have added. Depending on the company, some of these plans will also offer like exercise programs, like with Silver Sneakers or Denver Parks and Rec, or they will offer additional programs like they may offer some meal programs following a hospitalization or something. This is the list of the 10 companies that are licensed to sell Medicare Advantage plans in Colorado. However, not every company is going to sell in the county or the zip code in which you live. So Kaiser, for example, is not offering any benefits or any programs in Mesa County. Some of the other companies may or may not be offering benefits depending on where you live. The little cross represents that basically they have at least one plan that does offer the senior savings insulin model. So if you have a company and you're pretty much satisfied with them, but either you're a diabetic or you are afraid of being a diabetic in the next year or so, you maybe should check and see if the plan that you are either currently enrolled in or that you are planning to enroll in offers that senior saver opportunity if you are on Medicaid. It could save you Medicare, could save you several $100s a month, depending on how much insulin that you use. Medicare Advantage plans also are rated by both consumers as well as by Medicare in terms of things like consumer satisfaction, frequency with which they respond to complaints, whether or not people are dropping out of their plan, how many people they may have vaccinated, what kinds of chronic disease management programs they have. All of them then get a rating through Medicare. And we have one company in Colorado that has a 5-star rating, which is the best, and that is Kaiser. Kaiser Permanente does have that rating for a second year in a row. They've had it previously as well. And their 5-star basically did not change because Medicare didn't change those as part of COVID. The next thing we want to spend a couple of minutes looking at is Medicare Part D. This is the prescription drug coverage. The prescription drug benefit basically is offered through private insurance plans or private insurance companies. So some of the companies that offer Medicare supplements also will offer a Medicare Advantage plan, and they also will offer a Medicare prescription drug plan. So sometimes you can have coverage from your prescription drug or from your insurance company for more than one type of coverage. The premium for your Part D can be deducted from your Social Security card. What you need to make sure is that you let Social Security know if you change plans that you would like your premium to be deducted from your Social Security check. The open enrollment for changing your Medicare Part D, everyone is encouraged and should check your Part D plan between now and December the 7th for coverage if you change companies to start January 1 of 2022. The prescription drug plans do have the opportunity to offer what's called the standard benefit, which means that they offer everything that basically they adopt this formula or this format. If they want, they can change this format and file with Medicare for some other variation or version. Some of the companies for some of their plans have done that. The standard benefit basically has a $480 deductible. What that means is that the first $480 of prescription drug charges at the retail level at the drugstore, not what you pay, you have basically have to pay that deductible. So you pay both your portion as well as the retail pharmacy cost until you get up to $480. What happens under some plans is that some drugs that may be a tier 1 are also not necessarily, if the company decides they want to do it this way, subject to the annual deductible. Once the price of your prescriptions reaches $480, including that cost up to $1,107, you then pay that $107 out of the $4,430 retail price, or 25%. Once the cost of your drugs then gets over $4,431, you get into what we call the donut hole or the coverage gap. And when you are in the coverage gap, again, you will pay 25% approximately for covered generics and 25% for covered brand name. It's important to make sure that the word covered is understood, because what that means is that it's on their formulary. Just because it's an older drug, just because it's been around for a long time, does not necessarily mean it's on the lowest tier in terms of the prescription drug company, or it might also not necessarily be the cheapest drug. Once the total cost at the retail pharmacy of your drug charges reaches $11,480, then basically you get into what's called catastrophic coverage. And at that point in time, basically your copay varies. So if you are getting generics, you are going to pay $3.95 for generic preferred multi-source drugs with a retail price of under $79. So if your generic, if the pharmacy benefit manager or the pharmaceutical company charges less than $79 for a brand name drug or a generic drug, then you pay $3.95. If they charge more than that, then you pay 5% of the retail price. If you get a brand name drug and you are in catastrophic again, you'll pay $9.85 if the retail price is under $197, or 5% if the retail price is over $197. This is a list of the 8 companies that are offering prescription drug plans in Colorado. Most of them have more than one different offering. Unlike the prescription or the Medicare Advantage plans, prescription drug plans have to be available to every Medicare beneficiary in the entire state of Colorado. So You can select any of these based on the pricing and how you believe that their formulary is going to meet your needs, rather than based on the zip code that you live in. Medicare Advantage plan or Medicare Part D plans also have star ratings. These are similar to the Medicare Advantage plans in the sense that they're looking at customer satisfaction. They're looking at how many people have stayed compliant with their medications as a result of their behavior, and whether or not they can basically whether you get a good rating on that. At this time, none of the plans that are offered in Colorado have a five-star rating. Express Scripts is the company that is leaving the state of Colorado. So if any of you have Express Scripts, it is absolutely critical that you sign up for a new Part D standalone plan, or you can enroll in a Medicare Advantage plan with prescription drug coverage. But that is mandatory regardless of what you had hoped to do. Either way, whichever one you want to do, if you had Express Scripts, you are encouraged to do your review and research on the prescription drugs that you have through the plan finder at medicare.gov. The highlights in terms of the companies that are selling: WellCare is offering a very cost-effective premium of $5.50. It's the lowest one in the market this year. And the highest one is an AARP plan, almost $104, with the average or the benchmark being not quite $40. So there are a few plans under the $25 range if you are looking to save some money. This is especially true for those people who are not taking any prescriptions at this point in time, or maybe taking one prescription drug that is generic. You may want to just register for a basic plan, because that will probably save you some money. One of the things to know about in terms of prescription drugs is that they have tiers. So a tier 1, 2, 3, 4, 5, and 6. Tiers 1 and 2 are generally generics, one preferred and the other still lower generics, but may not be preferred. Similarly with brand name drugs. When you get into tier 5 and 6, you get into the specialty drugs, in which the cost may be as high as 50% of the drug. Not all companies have all drugs on the same tier, so it's really important that you go into the plan finder at medicare.gov and actually check out whether or not the plan that you have is going to work again for you, or whether you need to change. You still have a couple of weeks to make that change. Companies are allowed to change their formulary every 2 weeks. If they take the prescription off of the formulary, they do have to give you, as the consumer, a 60-day notice. There is a new drug called Adulan for Alzheimer's drug, which is still being reviewed under what's called a national coverage determination. What is happening at this point in time is that Medicare has not made any kind of a decision as to whether or not they will cover this prescription drug benefit. It is a Part B benefit if they do decide to cover it, because it is infusion therapy. So watch the public or the newspapers and other news outlets for more information as to whether or not it may or may not be covered. We are in a 60-day public comment period, and that will end soon. This drug is also not necessarily available to everybody who has prescription or who has Alzheimer's. So with that, that brings our formal presentation to a close. If you would like a resource packet, as we said at the beginning, send us an email at cogs@senioranswers.org with your name, address, and phone number, and we'll be happy to mail you a packet. If you would like additional information, you can also participate in our Medicare on the Porch. We've had a number of people drive by today already. Just park in the driveway, go up on the porch, grab all the information and goodies that you would like, and feel free to share those. If you would like any type of individual counseling, when you get the PowerPoint, you can register for an individual counseling appointment. We can help you with questions about your coverage, whether or not you want to do a Medicare Advantage or a prescription drug plan. If you happen to be new to Medicare, if you're having trouble paying your Part A or your B and D premiums, any of those kinds of things, feel free to call our counselors and they'll be happy to walk you through this. These are the telephone numbers for our counselors. So 855-293-6911 is our toll-free number, or you can call 303-333-3482, which is our general number. If you need support and assistance in Spanish, we do have a counselor on staff who can also provide support in Spanish, and our Spanish line is 855-880-4777. And with that, that brings our conversation for today to a close. Does